there?
I think where the government is still not doing well, or the policymakers still not doing well, is we need to incorporate the sexual and reproductive health into the curriculum, whereby we have a module whereby the students are taught in colleges and in primary and secondary schools, such that we get empowered with this information from younger age, knowing that if I see this, I need to do this, I need to do this. So one of the things which we need to do is incorporate sexual and reproductive health into the curriculum.
Okay.
It will be able to help.
All right. Let's talk about, preventative measures, which is critical. And as a country, we're at that level where we're talking about how best we can prevent us from getting, health concerns, diseases and all that. What are some of the things that people need to understand, take home this evening, that would be helpful for them to prevent themselves? Because I am actually just looking at basically how we operate, the question of condom use, as well as the gender norms that continue to exist. The cultural attitudes around sex, and gender, as well as how they get to affect us, and relationships, especially when we're talking about, the use of preventative measures.
One of the things we need to do in prevention is we need to do campaigns in the communities, because there are some communities whereby you can't talk about sexual health. Discussing sexual health is a taboo.
Yeah.
So we need to break this in the communities, such that people can discuss sexual reproductive health freely, so that we know what needs to be done. You talk about in prevention about condom. You don't just about condom use. You talk about consistent and correct condom use.
Okay.
So continuous education about consistent and correct condom use helps in breaking the transmission chain. The other bit is partner. If you check how we take history, actually we go 6 months. We date back 6 months. You have sexual contacts for the last 6 months.
Yeah.
Moment I'm diagnosed with an STI, my sexual contacts for the last 6 months need to be traced and be treated. But the referral system is whereby actually the type of care we give currently is a shared decision type of care. So I will ask for the sexual contacts will be given, then we'll agree on the modality to reach the sexual contacts. Because if you treat the sexual contacts also, we are breaking the chain of transmission, what we call pattern notification.
Right.
The other bit is health education. Today, if a client walks in, we don't just treat and let them go. We offer preventive education, such that if we give them the education, they will scale it down. Basically, the reach will be wider.
Okay.
At the same time, apart from the partner notification, condom, health education, I think basically those are the preventive measures which needs to be done. And now the last one is treatment with follow-up. Yeah, we have to ensure that we follow up these patients when treatment is initiated and the treatment outcome is a success.